Hey guys, Tony Maritato here. Welcome to the Total Knee Replacement Support Group channel. In today's video, I want to talk about pain. Pain can be one of those things that's so frustrating. I know so many of you got your knee replaced because you wanted improved function and less pain, and now some of you are sitting there with worse pain and less function. So let's talk about it. First thing I want to say is we don't have the answer to persistent pain. I wish we did. If anybody had the answer, nobody would be in pain. So think about it from that perspective. The best we can do is try to ask better questions to figure out what is the cause of the pain we're experiencing, how we can influence that pain positively, and what our long-term goal is going to be. So let's talk about pain. There's really kind of two, I break pain into two categories primarily. One is pain associated with tissue damage. So before the knee replacement, you had degenerative changes going on in the knee that was driving chemical changes that were producing pain. And then after the knee replacement, obviously you had the trauma from surgery, right? Not to get too graphic, but they had to cut open the skin, they had to cut open the connective tissue, cut off the ends of the bone, sew everything back up. There's absolutely trauma and pain associated with that tissue damage. A lot of you, if the surgeon used a tourniquet, you have thigh pain, you have calf pain. Again, all very common, all totally normal. So when I'm looking at pain from tissue damage, I'm looking primarily for normal changes in the pain, right? And so what does that mean? I expect the pain to get better with time. I expect there to be highs and lows. So in a classic situation, if recovery is going as expected, I would expect, maybe there's a 24-hour honeymoon period right after surgery. The pain's not too intense because of all the meds and everything involved with the surgery. Then we see the pain levels rise 48 to 72 hours because that stuff is wearing off and the reality of the tissue trauma is being experienced. But then we start to see it level off. And I would say by the end of the first week, by 7 to 10 days, there should be noted improvement in the overall pain. Yes, there'll be episodes where the pain shoots up and then subsides, but generally speaking, I would say day number 7, 8, 9, or 10 should be overall on average better than days number 3 and 4, okay? What happens if we don't have that experience? What happens if the pain just ramps up and ramps up and ramps up and never starts to plateau and ease? That's when I think you need to start looking at questions, asking questions that maybe aren't consistent with tissue damage, right? So of course, I talk to patients all over the world on a regular basis. And I recently had a conversation with a gentleman who had had a knee replacement several months ago. He was 3.5 months post-op. His range of motion was improving. He had passed 105 degrees of flexion. He had full extension, but he continued to be limited by pain. Pain was his primary complication. And so first question I ask is, if pain was completely eliminated, would you be satisfied with the function? Can you get off a couch? Can you get off the commode? Can you transfer into your car? Like, are you doing the things you want to do? And his response to that was yes. If there was no pain, the range of motion I have right now is more than adequate. But I can't use that range of motion because the pain is stopping me. And so then we go into the next series of questions and we try to determine, is there specific tissue that's contributing to the pain? Is there chemical changes, and I'll talk about that in a second, that's contributing to the pain? Where is the driver for this pain coming from? And so he had been to the surgeon, they had done imaging, x-rays, everything looked normal from a prosthesis perspective, the bone was healing well, the implant was in place, visually nothing was abnormal. And so when we take normal x-rays, normal imaging, and we combine that with generally decent range of motion and function absent of pain, we tend to think, well, maybe it's not a problem with the surgery. Maybe there's something else going on. And so through questioning, first thing I always ask about is there any existing autoimmune condition Is it possible that there's some inflammatory process going on at the connective tissue level, cellular? When you hear me say chemical problems, what I'm talking about is kind of increase in pro-inflammatory proteins locally in the joint, maybe due to an infection. That's everybody's concern immediately. But then also due to the immune response. So is his body not responding positively to the implant? Was there something involved with maybe an allergic reaction or a sensitivity to what was used during the procedure? That's absolutely something to look at. So when we talked about blood work, he said at one point he did have blood work. His white blood cell count was elevated, but when they looked at everything else, he was told things were fine. Now, what that means to me, and I'm certainly not a medical doctor, I'm not going to pretend that I can read blood work and understand what that is, but what that suggests at least is that we know there was something that was kind of out of whack because the white blood cells count was high. We just don't know what it was. We couldn't see the cause of that, but that doesn't mean that everything is fine. Clearly everything is not. And then when you put the elevated white blood count along with the continued pain that's not consistent with where he is in the rehab process, and you put that along with other environmental factors that just don't add up, that's where we need to keep driving forward. We need to keep asking better questions, So is it possible that there's some sort of autoimmune response going on that we're not aware of? Now, further questioning did indicate that this individual had some issues prior to surgery with thyroid function. I don't know if that's coming into play here. He's not seeing a rheumatologist. He's not really seeing anybody that's taking a step back and looking at the big picture. So that's where I would say for you, the individual suffering with this persistent pain and not really getting the answers. First, I don't think we know what the answer is. So let me put that out there. Second, I would be fighting to find somebody who's going to be on your side to ask these kinds of questions. You as the patient aren't expected to even know what to ask, but that's where your physical therapist, your primary care physician, somebody in the world of medicine needs to be on your side to say, hey, I don't know the answer, but I know that doesn't make sense. What about this? What about that? How can we look into these other things? And it needs to be somebody you trust. It needs to be somebody who, has reasonable scientific understanding of the condition and what's going on and has a background within the medical profession, so they are taken seriously by their peers, because that could be another issue where you have somebody that you like, you trust, you believe in, but the medical doctor doesn't believe or trust them. You lose credibility, and now all of a sudden you kind of brushed aside and not taking seriously. So the goal of this video really was to say, first, we don't totally understand what's causing persistent pain. Yes, it could be tissue trauma, tissue damage. Yes, it could be a chemical problem, an autoimmune condition. It could be inflammation in the connective tissue that wouldn't show up on x-ray, but you're going to feel it, you're going to see the effects of it. Localized, could it be something going on inside the joint that your body is negatively responding to? You know your body better than any of us, so when you know something is wrong, the chief priority is to find somebody that you can talk to, that you can relate to. And of course, right now, with the coronavirus and everybody being isolated, it's a great time to reach out to people through telehealth and virtual platforms. Get on a phone, even if you have to pay out of pocket, because a lot of insurance companies still aren't covering it. I think the peace of mind of being able to speak to somebody and say, hey, this makes sense, this doesn't. Let's go down this path and see if we can find an answer. That might help. Even if you don't find the solution to the pain, at least bouncing ideas off another professional to say, look, I'm not crazy. I know what I'm experiencing. Does this make sense to you? And having their experience to say, yeah, I've seen this before. It makes total sense. this is what I would do next. Guys, I hope this video was helpful. It's not my usual exercise video, but let me know in the comments if these kinds of Q&As are helpful for you, if they bring you peace of mind in any way, and what kind of challenges are you dealing with. Post your questions below so that I can produce new content specifically to help you and people who are in your situation. Guys, I'll catch you on the next video. Thanks so much.